A very good morning and welcome to News and Views with myself, Salailo Makudiri. Today we're going to be kickstarting the show with a very, very concerning state of events. We'll be diving into a critical development with regards to the Gauteng Department of Health. They've been criticized by many political parties, and the recent report that has been released that they failed to settle over 5.1 billion in supplier invoices within the mandated 30 days period for the first quarter of the 2025-2026 financial year, and raising serious concerns about service disruption and financial mismanagement. And to help us shed light on the broader implications and potential solutions to the state of Gauteng's healthcare sector and how much it's in disarray, we'll be talking to Dr. Aslam Dasoo. He's a respected healthcare activist and convener of the Progressive Health Forum, which have long advocated for universal access and effective governance in healthcare, something that we're not seeing coming out as strongly from the Gauteng Department of Health. Dr. Dasoo, thank you so much for joining us. Welcome to News and Views, and really appreciate you giving us your time this morning.
Thank you very much. Thank you for inviting me.
No, the pleasure is all ours. I think first and foremost, we can kickstart the show with maybe just your brief analysis and overview of the, Gauteng's health sector's state of health and just how much in disarray is it? How widespread are the issues, problems in the healthcare department's point of view? Where are we right now?
All right. So I think this particular discussion centers on the audit reports of the Gauteng provincial government. And again, it seems that according to the MEC for Finance or Economic Affairs, that the audit for the Department of Health has once again proved to be qualified with severe disqualification from the Auditor General. And this is a pattern. Okay, so this is repeatedly year after year after year. And so the first thing to say is that when the MEC for Finance reports this, he doesn't say at all what has been done to correct the situation and why this is happening repeatedly. They just announce it. So there's no consequence to this matter. Now, this matter is more than just a qualified budget audit, I beg your pardon. This goes to the heart of a deeper problem in the Gauteng Department of Health. It's been a serial failure in terms of its mandate and in terms of its budget. So the amount of money that hasn't been paid to suppliers is one thing. That could just point to some inefficiency. But the problem is that the money is not there when the money was there. And the difficulty now is to find out why the money isn't there. So let me just explain what that means. If the budget is not available, so for example, with staffing, you've got 30 to 40% vacancy rates in some of the most important hospitals in the country, which all sit here. In fact, Gauteng represents the most complex and comprehensive set of healthcare institutions anywhere on the continent. But it's run, and excuse the phrase, but it's run like a spaza, if you ask us. Now, the problem is that, in other departments, if there's a shortfall, if there's a delay in payment and so on, it's rare that it's immediately deadly. In healthcare, when there is a budget shortfall, the effects are immediate and the effects are deadly. People die. And these hospitals are already teetering on the brink. So when you've got this staff shortage with greater burdens of patients, population is growing, what you're getting is a perfect storm of an overwhelmed system. And when the system is overwhelmed like this, it's non-functional to any material extent. And when you're talking about tertiary care facilities, like we have so many here, the effects are dire.
And I think that's very, very concerning. In your view, what are the immediate steps should Gauteng Health take to restore fiscal discipline, both administratively and politically? Because I think that's the key part: the way that money is spent and how it is spent, and ultimately it not trickling down to what it needs to do.
Okay, so you mentioned both politically and administratively. Let's go with the latter first. That's
Sure.
pretty obvious. In any management of funds, especially public funds, there are clear set rules, and it's all well known. So the fact that it's not being managed in this way points to the second issue, the political management of this, which means there's a failure there. The word that I think is a favorite is they have challenges. And when I hear that, my heart just sinks because again, they're gaslighting us. It's a failure of governance. It's a failure of management. Now, this department has been the subject of such severe disasters, life esidimeni, and you get little life esidimenis practically on a daily basis, given the shortage of staff, the non-availability of equipment, medicines, etc. That all results in severe consequences to people. So the problem does not lie really at the facility level. Of course, the effect is felt there. The problem begins with a management and a governance that's so out of kilter with what is required ordinarily that it will shock you that such an important function is managed in this way. It's a 65 billion rand budget for Gauteng. 65 billion. It's more than enough to cover the services that are on offer. And this is, we're talking about the public health services, where 80 to 85% of the population is totally reliant on. And yet their daily experience is, you'll start with longer queues and then failure of supply of medicines and essential services. Waiting lists for surgery and for other procedures is just growing. And when you have that, then you have consequences on the health of people and them dying. If you'll allow me, let me just give you a context for this. In 2021, there was a fire at Charlotte Maxeke, Joburg Academic. This was in the middle of COVID and was a real disaster and desperate situation. And, it was what it was, and they tried to manage it in a very chaotic way. Other hospitals were overloaded with their patients, and it was just a disaster right across the board. In 3 weeks' time, this was actually quite rapid, the Department of Infrastructure Development had done an assessment and said it would cost 1.7 billion to fix, and it would only be fixed by 2026, 27. This was surprising, and the Department of Health didn't have any money, so they went to the Solidarity Fund, which was set up for COVID. And they agreed to help, but they wanted to do their own assessment. And they got in experts here and internationally. And in 3 weeks, they came out with an assessment saying it will cost 600 million rand to get back to 80% functionality in 6 months. Sorry, it will cost 600 million rand to get 80% functionality. Now, that is such a difference from the 1.7 billion and only getting ready by 2027. And when the Department of Health inquired of the Department of Infrastructure Development, they refused. They said, no, our assessment is what holds, and only our contractors will apply. The hospital is still not fully functional. And here's the effect. The oncology section was severely damaged. You might have heard of the Cancer Alliance taking the government repeatedly to court. There was a backlog of 3,500 patients already at the start of this saga. And it's grown, but not as fast as you might expect, only because the ones on the list have been dying because there's been no treatment. The government, the national government, made 750 million rand available. Guess what? It's gone. And the system hasn't been fixed. It hasn't been used for oncology. And even though the courts have now really severely criticized the government for not following its instructions, they are now appealing that because they don't have the money. It's disappeared. So what you have here is a system of governance that's criminalized. And what you can regard this as is a vast criminal enterprise. They take away all control of the budget from all the places where it should be, and that's at the local level. And they decide who will get employed and who won't. They have no reference to the situation on the ground. They parachute in CEOs into these hospitals who are their lackeys, who will just take their instructions, and no one can question that. When health workers, you have a doctor, it takes 9 years to qualify, making them the most technically proficient cohort of the entire professional sector. They take away all authority from them. They are trained to optimize the delivery platform, not clerks and an MEC who isn't a health worker. They can't do that, but they take on that function. And therefore, there's this gap. And in these situations, the gap is almost unbridgeable and causes deaths that can be avoided. Death. And it's as serious as that. These people must be shown the door. They should not have been appointed. She has been reappointed a second term. Should not have been there.
Just one last question before I let you go, Doc. I think it was earlier this year where there was, I think, around 3 HODs that were removed after failing lifestyle audits. Is that like part of a broader push to root out maladministration, would you say, or do such measures signal, a token gesture of some sort without any deeper reforms in governance, as you mentioned, and just general oversight?
I don't think I even have to answer the question. You've explained in that latter part exactly what's going on. It is performative. We did lifestyle audits. I think one of those HODs was the health HOD. This is a person who was parachuted again into this position after having been the head of the EMS services of Gauteng. During his tenure, the biggest and most well-equipped and well-organized EMS service was ruined, and then they promoted him. So when you talk about governance, you're not talking about the normal governance. There'll be a failure here, there'll be a failure there, but overall the system works. Their system of governance is not designed to provide health care. That much I can tell you. They are not fit to govern, especially the health system, because it's so sensitive. And their approach to health workers is so difficult and so inappropriate that many are leaving the system, and they're not improving the services there. So what you have is a problem that the people of Gauteng are going to face now, and have been facing, with worsening access to care because of these people. It's as simple as that. That's the management in the Gauteng Department of Health. They employ a lot of people. They even give them overtime, but they don't do any overtime. Yet they cut the overtime for doctors and nurses. And it's shocking. It is a terrible indictment. You don't expect even this premier to do anything. He reappointed her. The president and the national minister should actually do something. But they also sit back because, you can't interfere in the province. What a load of rubbish. Utter rubbish. The country and this province are being governed to the ground. That's all I can say.
And that's an unfortunate turn of events, Doc. Thank you so much for joining us. And I think unpacking for us, I think quite extensively, just the rot that is unfolding in Gauteng's Department of Health. We really appreciate it. There you go, Dr. Aslam Dasoo, healthcare activist and member of the Progressive Health Forum. Really, really concerning insights, and I think we're just going to leave it at that. I think we all know at this point how hospitals and clinics in Gauteng look, and as Doc said, almost 80% of the people relying on them. You would think that there should be more, that could be done from Gauteng's health department. So yeah, really, really concerning state of affairs, and yeah. People die when things like this happen, and we don't talk about it a lot. And I like that he unpacked that in other areas when systems fail, you might not get your water, your electricity might be off, but Department of Health lives are being lost. And I think that was well documented when Shalom Makleke burnt down and their oncology department was in ruins, and people started losing their lives because actions were not taken, the right people were not in the right place to make sure that that crisis was mitigated on time. People were only concerned on stealing and stealing and stealing, and people died. Going to take a quick break. When we come back, News and Views continues.